Hello, everyone. This lecture focuses on quantitative clinical assessment in social work. Quantitative clinical assessment involves categorizing client characteristics, assigning diagnostic labels, and tracking problem behaviors over the course of treatment. It discusses the use of standardized and unstandardized measurement to add specificity and concreteness to assessments. This module also highlights evidence-based assessment and the importance of measuring client behaviors as part of the assessment process. It provides examples of specific behaviors that can be measured across different settings, such as disruptive behavior in school, home, and community. The concept of precision psychiatry and its impact on assessment methods is explored. The module includes various methods for assessing clients, such as self-reporting, questionnaires, direct observations, and psychophysiological measures. It emphasizes the importance of evaluating client change and effective intervention planning through assessment methods. Clinical assessment aims to comprehensively understand client functioning, incorporating their biopsychosocial and spiritual aspects. Social work practitioners create narrative assessments based on interviews, but these can be biased. Quantitative measures enhance this process, offering objective insights into strengths, behavior, and attitudes. Using multiple sources of information, including quantitative data, helps achieve more accurate assessments. Measurement-based care, which becomes an important part of precision psychiatry, involves continuous data collection for improved client engagement and treatment outcomes. Objective assessment informs treatment adjustment, leading to better results. Objective measures bridge research and practice. This is vital for demonstrating accountability and efficacy to funding sources. Continuous client monitoring aligns with precision psychiatry's emphasis on evidence-based assessment. Quantitative assessment methods play a pivotal role in social work practice evaluation. This module emphasizes the significance of incorporating quantitative measures and outlines various assessment techniques for gauging client problems, behaviors, and objectives. The prevalent methods include client self-recording and self-monitoring, where clients document their thoughts, feelings, and behaviors. Self-recording involves retrospective reporting, while self-monitoring requires real-time observations. These tools yield baseline data revealing similarities or differences from clinical samples or the general population, thereby justifying treatment. They help with accountability demands and inform treatment strategies. Though not highly scientific, they offer valuable clinical observations. When used along standardized scales, self-recording and self-monitoring enhance the validation process. Encouraging real-time collection of data enhances accuracy. Despite their supplemental nature, these methods align with client-centered practice and are favored in clinical social work assessments. Self-anchored scales are customized measurement tools co-constructed by social workers and clients to assess specific issues or goals, fostering client engagement in their treatment process. These scales capture the nuances of a client's experience, allowing them to rate their feelings or behaviors on a personalized continuum, enabling the monitoring of progress over time. Rating scales, a related tool, involve collaboration but are completed by an external observer, providing an additional perspective on client functioning. While not rigorously scientifically validated, both self-anchored and rating scales offer clinically meaningful insights into client progress and can be used together for a comprehensive assessment of client issues and behaviors. Questionnaires are a valuable tool for gathering assessment information from clients, offering flexibility in obtaining specific or comprehensive data. Social workers can choose from existing commercial questionnaires or design custom ones to suit their practice needs. One notable standardized measure is the multi-problem screening inventory, assessing clients across 27 different personal and social functioning areas. The PHQ-9, a depression measurement tool, exemplifies questionnaires designed for specific settings. The main advantage of questionnaires is their efficiency in providing background and screening information without lengthy interviews. Empirically validated tools like PHQ-9 or GAD-7 are especially valuable due to their brevity. Social workers should carefully select questionnaires based on their intended purpose, as some are better suited for gathering history and formulating treatment plans than monitoring clients' changes. However, exceptional questionnaires like the multi-problem screening inventory can serve multiple purposes, including outcome monitoring. Choosing the right questionnaire is crucial for effective assessment and intervention in social work practice. Direct behavioral observation is a powerful method for assessing client behavior, offering precision through measurements of frequency, duration, or intervals. To utilize frequency measurements, behaviors must first be defined and can be observed continuously or periodically through time sampling. Observers must be trained to recognize and record the behavior accurately. Using multiple observers allows to implement inter-observer agreement assessment that ensures consistency in recorded behaviors. An agreement of 80% or higher is generally acceptable in clinical context. This method is particularly effective in residential and school settings where natural behaviors can be observed by professionals comprehensively. Direct behavioral observation is essential when other assessment methods are impractical or less reliable, especially when we work with clients who experience psychotic disorders. Clients with psychotic disorders are often evaluated by clinicians who use measures like the clinician-rated dimensions of psychosis symptom severity. Role-play and analog situations are valuable tools for assessing clients' behaviors in social work practice. These scenarios allow clients to demonstrate specific behaviors within the controlled environment of the social worker's office. During role plays, clients act out behaviors while the social worker observes and provides feedback. For example, a social worker can simulate a conversation with a client's lazy spouse to assess communication patterns. This observation informs therapeutic strategies for goal achievement. Repeated role plays over time enable progress monitoring through methods like rating scales or recording improvements in a log. Videotaping or audio taping role plays provides further insights and helps clients understand their behavior. Vignettes, structured scenarios with questions, offer another analog approach for assessing behaviors, such as problem-solving skills, allowing practitioners to guide clients in skill development. These analog methods enhance clinical practice and provide valuable insights for both social workers and their clients. Psychophysiological measures offer a crucial assessment approach by quantifying clients' behaviors through mechanical and technological means related to physiology. They are extensively used in evaluating psychophysiological disorders, for example, high blood pressure, anxiety disorders, stress and panic attacks, or sexual disorders like pedophilia. Here are examples for these categories. For psychophysiological disorders, we can use instruments like sphygmomanometer, which measures blood pressure, clinical biofeedback measures such as electromyographic activity and galvanic skin response assess muscular tension and skin conductance. For anxiety disorders, we can use neurofeedback and electroencephalography, biofeedback technique or technologies which gauge anxiety and stress levels. Quantitative EEG brain mapping objectively evaluates brainwave function, helping identify deviations from the norm. For sexual disorders, we can use the penile plethysmograph, measuring penile circumference based on blood flow changes. It is vital for assessing sexual disorders like pedophilia. It aids in measuring deviant sexual arousal during exposure to various stimuli. Psychophysiological measures enhance our ability to scientifically and reliably assess client functioning. Advances in wearable tech and virtual reality further expand their clinical application, making them valuable tools in mental health assessment and treatment. Goal attainment scaling, GAS, is a valuable method for measuring changes in client problems based on their treatment goals. Social workers often use GAS to evaluate specific client or program outcomes, making it an essential tool for ongoing assessment and monitoring. GAS allows practitioners and clients to define various levels of progress toward treatment goals, ranging from least favorable to the best expected outcomes. Goals are operationalized collaboratively, and GAS is employed throughout treatment to track progress. This approach has been effective in assessing clinical change, client improvement, and evaluating practice outcomes across various clinical settings. Standardized measures are pre-established assessment tools with proven reliability and validity, extensively researched for their statistical and psychometric properties. Standardization ensures uniformity in scoring and administration, giving practitioners confidence in their ability to assess specific client behaviors for which they were developed. Despite their often strong psychometric properties, practitioners should be aware of potential flaws in scale properties and clinical utility. These measures cover a wide range of human behaviors, including personality, intelligence, self-esteem, marital satisfaction, and more. Some evaluate overall traits, like revised NEO personality inventory, while others focus on specific aspects like mood, such as back depression inventory, or psychological distress, for example, brief symptom inventory. Standardized measures can be self-reported or completed by others, like parents or teachers, and come in both quick assessment formats and comprehensive tools. One example is CESDR, primarily used in research to assess depression. Another is the Youth Outcome Questionnaire, YOQ, designed to track outcomes for children and adolescents. Standardized measures often employ criterion reference and norm reference interpretations, with criterion reference measures assessing mastery of specific content and norm reference measures comparing client scores to a normative group. Both types find applications in clinical assessments. The DSM-5 TR incorporates standardized measures as essential components in patient assessment and comprehensive case formulation. Notably, it includes a section on cross-cutting assessments, which are designed to evaluate symptoms of high importance in various clinical settings, irrespective of specific disorders. These assessments consist of two levels. Level 1, self-report measures cover major clinical domains such as depressed mood, anxiety, and suicide risk. If any level 1 domain is clinically significant, level 2 clinician-rated follow-up measure provides a detailed assessment of endorsed symptoms. Both adults and child versions are available. Many level 2 cross-cutting symptom measures in DSM-5 draw from the patient-reported outcomes measurement information systems, or PROMIS, a comprehensive program initiated by the National Institutes of Health. PROMIS offers a wide range of measures across physical, mental, and social health domains for adults and children, supporting a dimensional and scaled approach to assessment. This approach recognizes that disorders exist on a spectrum, which provides valuable clinical tools for practitioners to determine the most appropriate therapeutic plan. Incorporating standardized measures and dimensional approach enhances the clinical utility of the DSM-5. This approach offers more comprehensive and precise assessments. Projective measures are a unique category of assessment tools widely utilized in clinical practice. Unlike structured quantitative assessments, projective measures offer tasks that invite diverse and open-ended responses. For instance, clients may be asked to complete a sentence or describe a picture. The renowned Rorschach test is a prominent example of the projective measure. Most projective measures aim to evaluate global personality functioning and unveil hidden or unconscious personality processes, often rooted in psychoanalytic concepts. However, they have faced substantial criticism for their clinical inadequacies and lack of psychometric properties like reliability and validity. Despite these criticisms, projective measures remain popular among clinicians because they enable exploration of latent and broad aspects of client functioning. They allow for global interpretations, similar to clinical interviews. While they have quantitative weaknesses, they can still be valuable in comprehensive assessments for generating hypotheses about client characteristics. Common projective measures include incomplete sentence forms and draw a person DAP test used to assess intellectual maturity and, to some extent, personality. Other well-known projective measures include the Rorschach test and the thematic apperception test. So the projective measures, though facing criticism, continue to be a vital part of clinical assessment, offering a unique perspective on client functioning. Clinicians use them cautiously to generate global hypotheses about personality and psychological attributes. Precision psychiatry and application of precision medicine in psychiatry seeks to enhance diagnostic accuracy and treatment quality through advanced tools and technology. While other medical fields have embraced precision medicine, psychiatry has been slower to integrate these innovations. Recent progress in biomarkers, big data, and digital phenotyping has sparked interest in precision psychiatry. Digital phenotyping leverages smartphone capabilities to continuously monitor patient behavior, cognitive function, and mood through sensors, keyboard interactions, and voice analysis. This data-rich approach holds promise for improving clinical judgment and diagnostic accuracy, but widespread adoption will require extensive interdisciplinary research and collaboration. In the context of social work assessment, it's critical to navigate through a multitude of available quantitative measurement methods effectively. The following guidelines can help in this process. First, Establish baseline indicators of client functioning. Deviations from general population data may signal the need for treatment, while similarities to clinical samples also suggest intervention. Regularly administer measures at pre-test and post-test stages and consider follow-ups. Next, employ repeated measures to monitor client progress throughout treatment. This approach aligns with single subject design principles, offering valuable feedback and potential treatment improvements. Finally, incorporate specific and global measures of client issues to increase the opportunities to capture behavioral changes. In assessment, it is important to balance the self-report and external perspectives. An ideal assessment system might include a standardized measure of self-anchored scale, a behavioral observation, and a standardized or self-made rating scale from a significant other. Utilizing both client self-reports and external perspectives minimizes bias. Avoid overwhelming clients with excessive assessment tools. Sometimes one well-chosen measure is enough. Clinical measurement, like practice, blends art and science, requiring practitioner knowledge, creativity, and adaptability to suit each unique client situation. Quantitative measurement is a vital component of social work assessment, involving the assignment of numerical indicators to various client attributes. Incorporating quantitative measures into assessments enhances the understanding of client functioning. This lecture discussed 10 measurement methods, including self-report, scales, questionnaires, direct observation, and others. Guidelines were provided emphasizing the importance of using multiple methods, establishing baseline indicators, employing repeated measures, and incorporating both global and specific measures. By following these guidelines, social workers can gather valuable data for a comprehensive understanding of clients. High-quality, quantitative data can enhance assessment and facilitate planning of the effective interventions.